good afternoon. This is Jacquie here live at CES at the Digital Health Live studio. I'm here with Jacquie Finn, who's the head of digital health with Cambridge Consultants. Welcome, Jacquie.
Thank you.
Why don't you tell us a little bit about what Cambridge Consultants does?
Yeah, sure. Hi. For anyone who doesn't know us, we're a product development and tech strategy company, unlike our name. And we've been going around 60 years, and in healthcare, we tend to work with pharmaceutical companies, medtech and consumer tech companies to develop smart, connected, regulated devices and the digital ecosystem that sits around them.
Well, that's really great. So what can you tell me is going on the digital health side around clinical trials?
Sure. I think it's ripe for innovation, and it's ripe for digitization. It's very paper-based, it's very expensive, it's very time-consuming, it's really inefficient. So things like sensing and AI and remotely monitoring people and gathering real-time contextualized data sets on them is, I think, where we're going to go, because we can start to understand much more about how drugs are working in the body if we do things like maybe measure stress, for example, which will affect the pharmacodynamics of drugs. If we can measure it in real time using sensing and AI, we can start to investigate it as a confounding factor and stop looking at drug results as a yes or a no and start to be a bit more subtle and granular and start to look at, are certain conditions obfuscating those outcomes, and can we do anything about it? So I'm giving a talk later about that and how you can definitely improve the likelihood of success, because 80% of clinical trials, did you know, they fail?
Right,
so
and isn't one of the issues with clinical trials anyway is especially for a lot of things, it's on the person who's actually, I'll call them the user or the patient. So.
Yes. There's a huge rate of non-compliance. I mean, none of us comply anyway when we're supposed to take drugs. So in a clinical trial, it's no different. And we think that stress, and most people are under stress in a trial, it's impacting their outcomes. And withdrawal rates are at about 30% across a trial. And it's about 20,000 to keep recruiting a new person. So it's a huge money pit. So if we can stop the non-compliance and the withdrawal by understanding a bit more about what's going on, and if they're stressed, do something about it sooner rather than later, I think it's really useful. So we've created a platform that allows you to measure and monitor people's stress in real time.
So do you think that the way we do clinical trials around the world will change in the next 10 years? And what's kind of your forward looking on that?
I think it has to, simply because it's about 2.6 billion and about 12 years to bring a drug to market. And about 7 of those years are in clinical trials. So the longer you spend in the trial, the less time before the patent expires the pharmaceutical company has to make their money back. And trials, there's loads more trials going on. So if you can digitize them and be smarter about them and make them more efficient, then the pharma company, it's a win-win, right? Because they get more time to make their money back.
Yeah, so how can people that are watching us learn more about your platform and more about how to reach you at Cambridge Consultants?
So our platform's called Verum, and we did a press release. You can Google that. But also we're talking at 4:30 today, and it'll be, I guess, kind of on the website afterwards. But yeah, it's Verum, so they can have a look at that and see what we did.
Well, thank you so much for joining us in studio, Jacquie.
You're very welcome.
We appreciate it.
Thank you.
And this is Jacquie here at the Digital Health Live studio at CES 2019, hosted by Living in Digital Times.